Pharmacodynamics in veterinary medicine. Pharmacodynamics, PD, is the study of how drugs interact with the body to produce effects. It explains a drug's mechanism of action, potency, efficacy, and safety, helping veterinarians choose the right treatment for animals. How drugs work. Mechanism of action. Drugs act by binding to receptors, enzymes, or ion channels to modify biological functions. Receptor interaction. Most drugs work by binding to specific receptors. Agonists activate receptors to produce effects. Morphine, opioid receptors, pain relief. Antagonists block receptors and prevent activation. Atropine blocks acetylcholine, increased heart rate. Enzyme inhibition. Some drugs block enzymes to prevent chemical reactions. NSAIDs, carprofen, meloxicam, inhibit COX enzymes, decrease prostaglandins, decrease inflammation. Organophosphates inhibit acetylcholinesterase, increase acetylcholine, nerve overstimulation. Ion channel modulation. Some drugs alter ion flow in cells. Lidocaine, local anesthetic, blocks sodium channels, prevents nerve signals, numbness. Calcium channel blockers. Amlodipine, prevent calcium entry, lowers blood pressure. Neurotransmitter effects. Some drugs modify neurotransmitters in the brain. Xylazine, sedative, stimulates alpha-2 receptors, sedation and muscle relaxation. Fluoxetine, antidepressant, increases serotonin, reduces anxiety in dogs and cats. Drug-receptor interactions. Affinity. How strongly a drug binds to a receptor. Higher affinity equals stronger binding. Efficacy. How well a drug activates a receptor to produce an effect. Potency. The dose needed to produce an effect. Lower dose equals more potent. Types of receptor actions. Full agonist, maximum effect. For example, morphine to strong pain relief. Partial agonist, weaker effect. For example, buprenorphine, moderate pain relief. Competitive antagonist, competes with agonists to block receptors. For example, naloxone blocks opioids. Non-competitive antagonist binds permanently to receptors. For example, aspirin, irreversible COX inhibitor. Dose-response relationship. A dose-response curve shows how drug effects increase with higher doses. Therapeutic dose, ED50. Dose effective for 50% of animals. Toxic dose, TD50. Dose causing toxicity in 50% of animals. Lethal dose, LD50. Dose that kills 50% of animals in a study. Therapeutic index, TI, equals TD50 over ED50. Higher TI equals safer drug. Example, penicillin. Lower TI equals risky drug. Example, digoxin.
Small dose difference between safe and toxic. Drug tolerance and dependence. Tolerance. Reduced response after repeated use. Example, long-term phenobarbital use in epilepsy. Dependence. Animal requires the drug to function normally. Example, opioid withdrawal symptoms.
Factors affecting pharmacodynamics in animals. 1. Species differences. Cats lack glucuronidation, affecting metabolism and increasing toxicity risks with NSAIDs and opioids. Dogs metabolize most drugs efficiently, but some breeds, like greyhounds, may metabolize slowly. Horses have slower metabolism for certain drugs, requiring careful dosing. 2. Age and health differences. Young animals have underdeveloped liver and kidneys, leading to drug accumulation and toxicity risks. Older animals have reduced organ function, requiring dose adjustments to prevent adverse effects. Health conditions, liver, kidney, or heart disease can alter drug metabolism and need dosage adjustments. 3. Drug interactions. Combining drugs can enhance synergy or reduce antagonism effects, affecting safety. For example, NSAIDs plus steroids increase ulcer risk.